Now for glomerulonephritis and nephrosis, also called nephrotic syndrome. Not a big topic on the NCLEX or exit exams, but it may come up on your nursing exams. So anytime you see the word neph, think kidney, and itis, think inflammation. So glomerulonephritis is inflammation and scarring of the kidney, specifically inside the glomeruli, the little washing machine bubble inside the kidney. Now this inflammation sort of stretches out and destroys our little glomeruli, causing increased permeability, kind of like poking holes in a coffee filter. Since the kidney acts like a filter, instead of filtering protein, well, now it leaks out. Now on the other side, for nephrotic syndrome, also called nephrosis, the key difference is we get high, massive amounts of protein being dumped into the urine. And for glomerulonephritis, we get those low, mild amounts of granular proteins. Now in terms of the causes, nephrosis is caused by autoimmune diseases like lupus, where the body attacks itself, hurting the kidneys, triggered by the 4 S's that initiate an immune response. And this goes nearly for all autoimmune diseases. So we have stress, sickness or sepsis, basically infection, S for smoking, and then the last S is for sun or hot temperatures. And on the other side, glomerulonephritis is different in that it's caused by an infection, typically a strep infection like strep throat, that travels to the kidneys and resolves by itself within 14 days once the infection is gone. So we get the same sort of inflammation, but just from different causes. Now the big key point to write down here is that nephrotic syndrome, as mentioned before, we have big protein loss in the urine. So the UA will show high proteinuria, and blood labs will show low albumin, that hypoalbuminemia. So the memory trick for nephrotic syndrome, just think Nerf balls of protein. Remember those toys you used to play with as a kid? So just think of a bunch of Nerf balls of protein being dumped from the body and into the potty. Now that was the most tested clinical manifestation on most exams. Now for a little side note here, this part is not really a big focus on the NCLEX, but maybe on your exams. So other manifestations, we have edema that is present with high permeability of the kidneys, a high risk for clots in the body like a DVT or a PE, and this results because as protein is lost, a special protein that helps thin the blood is also lost. It's actually the same protein that heparin uses in order to be effective in thinning the blood. So when this is gone, it leads to blood clot risk all over the body. Now lastly, hyperlipidemia, those high lipids in the blood, result as the liver tries to compensate for all that low albumin. But again, it's not a need to know for the NCLEX, it usually just focuses on the protein. Now on the other side, for glomerulonephritis, we have less protein being dumped. So the UA will show lower proteinuria. And since it's caused by an infection, the key assessment findings will see recent strep infection, a fever, as well as blood labs will have high WBCs, since the body is typically fighting that infection. Now for both conditions, the 2 kidney labs will be increased. So the key terms, creatinine over 1.3 means bad kidney, and BUN over 20. And lastly, as a general rule, urine output 30 mLs per hour or less typically means the kidneys are in distress. Now, since the kidneys are inflamed here, we get fluid retention and classic fluid volume overload signs and symptoms, ending up with a high blood pressure, edema, JVD, and crackles in the lungs, that fluid in the lungs. Now, this results in deadly complication with renal failure and hypertension crisis. We're talking BP so high that the client can have a bursted blood vessel inside the brain, known as a stroke, or aka a CVA. So we must report these key signs, write these down. A headache and mental status changes, as well as nausea and vomiting. These 2 are the most classic signs for hypertension crisis. And lastly, oliguria, that no or low urine output, as well as new, sudden, or rapid weight gain. We must teach the client to report any of these signs to the provider immediately. Now, as far as treatments for nephrotic syndrome, we treat the causes by removing the trigger and helping the body to stop attacking itself. And we treat the inflammation and swelling. So we give steroids to soothe and stop the swelling to heal those kidneys so that protein doesn't leak out. Now, steroids ending in zone like prednisone. So just think zones treat the swelling. Now watch out for the double S's of zones. They increase sugar and increase the risk for sepsis, basically that infection. Now the diet here, this is the key difference. Be sure to write this down. In nephrotic syndrome, we increase protein. Big NCLEX tip. Since the key sign here is that massive Nerf balls of protein with nephrotic syndrome. This is the only kidney disease where we actually increase protein. So write that down. All the other kidney conditions, we limit protein. Now for glomerulonephritis, we treat the cause of infection by giving antibiotics, and the big key term here is to educate the client to finish all the antibiotics. And the big key difference again in diet, we limit protein. Big NCLEX tip there. Now lastly, for both conditions, we want to rest the kidneys and give them a day off. They're hurting and they're inflamed. So we do this by decreasing the blood pressure to take the workload and pressure off of them. So for diet, we want to lower fluids and lower sodium, that sodium restriction. So just think, sodium swells the body with fluid, increasing the blood pressure. And for medications are antihypertensives to decrease the blood pressure. Mainly we use the A's and the D's on our chart here. So A is for ACEs and ARBs. ACEs end in pril like lisinopril, and ARBs end in sartan like losartan. And as far as our diuretics, these end in ide, so think the body is dried. So for loops, we have furosemide, and thiazides, we have hydrochlorothiazide. Now both of these guys are potassium wasters, so watch out for hypokalemia, that low potassium below 3.5. All right, guys, that wraps it up for this segment. Don't forget to take your quiz and